that and I thought, there's no justification with that simply because if in fact there's been 1 million women who have died from an illegal abortion, since that point in time, I believe there's been roughly a 53 million who've had abortion in the United States since it became legal. So yeah, I don't think the debate is complicated. Abortion by and large has been used as a contraceptive, and it doesn't take into account the right of the baby. Ultimately, we hear about the woman's right, the man's right, whoever's right. The person who's never been asked, who can never reply, is in the womb. And how do you balance that out? I mean, so I guess I've noticed that with the pro-abortion folks, they've been born. And so ultimately, where does that stand? Where is the equality with that? So the debate in my mind is short. It is simply short. Life is life. You take it. It's simply a termination of life, and it's as simple as that. Thank you.
Thank you very much. Questions, committee? Thank you very much, gentlemen. Thank you for coming and testifying. Okay. Go ahead, ma'am. Introduce yourself and go ahead and speak to the committee.
Dr. Sarah Gregory. I was born in Gillette, Wyoming, graduated from Campbell County High School, educated by the University of Wyoming, and I thank the Wyoming taxpayers for the hundreds of thousands of dollars they've invested in my education through the WWAMI program and through my undergrad. And I feel like Wyoming has invested in me to become educated in the practice of medicine. And I think that one of the struggles I see in this legislative debate regarding abortion is lack of understanding of medicine, these bills being driven by lay individuals without consulting those practicing medicine. I mean, if we speak at all, the lay term is miscarriage. In medicine, we never use the term miscarriage. All loss of pregnancy, but prior to 20 weeks is an abortion, cut and dried. But there's a lot of gray matter in discussion. What about a fetus with a heartbeat and a dilated cervix? That's called an inevitable abortion. That woman may chronically bleed, maybe not to death, but where do I draw that line? Do I draw it when she's tachycardic and I send her to the ED for a transfusion? Do I draw that line when I'm actively having to operate on her, when I'm sending her to the ICU? I mean, these are medical decision-making processes that I sit with these women, inevitably in my office with loss of pregnancy. 1 in 3 pregnancies ends in miscarriage. In spontaneous abortion, that's the medical term for miscarriage. But there's also those in-betweens, like inevitable abortion. And I think the lack of understanding is spoken to by the general public and this bill. That takes away kind of the liberty and autonomy of physicians, of me having that discussion with my patient in my office, of determining if it is a therapeutic abortion, if I'm offering her a chemical option, so which is safe up to 70 days of pregnancy. And a significantly safer option if she chooses to want to do that at home with her husband, whether it is a spontaneous abortion, a missed abortion, that means a fetus without a heartbeat within the uterus, that I would treat exactly the same way as I would a therapeutic abortion for a patient who had undesired pregnancy. And so in counseling patients, it's very similar, but I offer each and every one of my patients in my office the option between medical management, surgical management, which comes with its own set of risks, and management of abortion types with at home, allowing them to pass spontaneously. And again, that's the woman's choice that I have with her in my office to allow her the autonomy of her body to make that decision.
15 seconds if you want to wrap it up.
So I speak to this group against this bill to support, I think, the practice of physicians within Wyoming to care for the women of Wyoming.
Thank you very much. I feel so much like the Grinch up here telling people 15 seconds. I am the Grinch, it's true. Questions for the doctor committee? No questions. Go ahead, sir, introduce yourself.
Excuse me, Chairman, Senators, and thank you, Dr. Gregory. I'm Dr. Austin Barnes. I'm born in Colorado, just down the road in Greeley. Raised all of my life in Nebraska, and then went to Texas for residency. And now come to find Cheyenne my home and hope to have it as my home for quite some time because it is a great community. Okay, I think highly of Wyoming, I think highly of Nebraska, and I like Colorado for its reasons as well. Okay, but coming from Texas, I can give you examples of some of the things that our own doctors have said. I had a patient who got Cytotec, which is one of these pills that we're speaking of. She thought she was only several weeks pregnant. It came over the border in the mail from Mexico. She was 30 weeks pregnant. So she started taking the pills, about caused her to have an abortion, but she was 30 weeks pregnant. So she delivered a baby at home that nearly died as a result of her still being able to get these meds that she wasn't able to otherwise legally get because we were out in the middle of nowhere. The closest access to abortion clinic at my area was 4 hours away. It was still legal at that time, okay? But since the most recent enactments down there, it does not become. Now, to the second point that pharmacists will have problems with this drug, it's not only a problem of legality, but it's also a question of what are their values? What is their background? If they have religious qualms or ethical qualms with abortion, then they often will refuse to give this drug regardless, okay? Now, a third little snippet I will put in here, and I don't have, and this is the reason I had to apologize to you earlier, I'm 24 hours now, 26 hours post-call from delivering 3 babies last night via C-section, which were very urgent, emergent C-sections, each one of them. And with each pregnancy that you have at full-term delivery, your risk of dying is still higher than with a miscarriage or having a Cytotec abortion. So I thank you for listening to me, but that is anecdotal truth as well.
Thank you, Doctor. Questions? Senator Dockstader.
Thank you, Mr. Chairman. Doctor, thank you for coming. You practiced in Texas. I'm assuming they had this same similar law, and you're saying they had that problem of, even though we have specific wording, eliminating these drugs causing abortion, they had the cultural problem as well as what do we do? What do we do with this? This is, some just won't do it because, I take it you said because of their own values, but are there other matters?
I encountered more.
Please speak through the chair when you speak.
I'm sorry, I wasn't trying to direct it at
No,
any one
you're fine.
person, just post-call and delirious at this point, excuse me. But it was more a religious sort of exemption that they qualified them not wanting to prescribe this pill for. Meanwhile, I was having a patient bleed significantly out as she was trying to legally have this miscarriage, essentially.
Senator Bouchard.
Thank you, Mr. Chairman. We hear these cases that have been brought, but almost 90% of the answers when women were surveyed, these issues that you mentioned aren't in the bulk of that 90%. It's, not ready for a child, can't afford it, have other people depending on me. I have grown children, done with childbearing. Don't want another child, don't feel mature enough to raise a child, would interfere with my education plans, would disrupt career plans. Those are 90% of the answers. And it was troubling to me to hear the opposition to a doctor that has religious beliefs. Do they not have the liberty to have those beliefs as well? I mean, so given the testimony on the minor percentage, when this bill is directed at the 90% that are using this for contraception, that's where what's your response to that?
I'd respond that that's 90% of women who aren't healthcare providers who have to do this for their patients every day.
Okay, thank you very much for your testimony. Now, before we do a whole bunch further here, realize that we're now an hour and